Thank you very much for invitation.
You're welcome.
It's a great pleasure for me to share with you my experience in regenerative medicine and in different fields of application of these new frontiers of aesthetic medicine and therapy. So, Autologous Regenerative Therapy, ART, the acronym is an autologous homologous microfragment tissue graft. So, it carries the power of the stromal vascular fraction, the mesenchymal adipose-derived stem cell, growth factors, and exosome. All these kind of cell and growth factors regenerate the skin, restore the volume, and the subcutaneous tissue. So, with ART, we can improve the loss of volume, fight the aging of the skin, and also the sagging skin, the sagging tissue. How we can see in this picture, in this video, we can regenerate the skin and restore the volume in the same section. ART is not volumetric therapy, but is a restorative procedure. Now, let me focus on our tissue graft. 1 milliliter of tissue graft is rich of different kind of cell, like adipocytes, stromal vascular fraction, ADCC, so fibroblast, pericyte, preadipocytes, but also the exosome. So it's a real tissue. So different kind of cell combined to improve, to differentiate in a different kind of function and activity. Does work? Oh. So 1 milliliter contain 200,000 stromal vascular fraction, since 3 million of nucleated cell, and 2,000, 10% of ADCC, pericytes and adipocytes fibroblasts, and also with a specific property of differentiation, production of GAG and collagen by fibroblasts, angiogenetic activity, homing, the migration into the injected area, antifibrotic activity, and also immunomodulating activity. At the end of my presentation, I will show you some case treated with the ART to improve the healing process as a scar and infection. So, the exosome. We recently we are working in this field, and we are in PUB, in STEMP, with a new article from the literature, and we study the exosome. The exosome are nanovesicles derived from multivesicular endosome and secreted by the cell. The exosome may act importantly in maintaining the body homeostasis, but also are very important to communicate the speaking between the language between cell to cell. So, they are secreted by the adipocyte body, and the mechanism proposed is related to the cell paracne effect mediated, among the other, by exosome. This is the paper that we are working, and this is published, but focus, I want to show you. In vitro, we demonstrated that fibroblasts treated with the exosome obtained by fragmentation with the Cephi shows a 23% greater increase in production of hyaluronic acid, collagen type 1, and elastin. So the importance of autologous exosome, because they know the language between the different kind of cell and mediate the communication. So the dispositive is all-in-one, is very simple and very safe, demonstrated, is the unique device for aesthetic regenerative medicine designed for aesthetic physician, disposable, all-in-one. Also sterile, obviously. The harvest area that we can pick up our tissue is the abdominal area, the peritrochanteric area, the knee, and we take off a small cluster with a 2 millimeter diameter cannula, make the tissue more fluid, easily injectable. We publish also this property, so the safe of the disposable is demonstrated also in the literature. We can fragmentate the tissue between a syringe, with move the fat between one and another one syringe from 8,000 to 200 nanofat. The difference between the other devices in the market are the mechanism that we use to obtain our fat, or the not mechanism, because we take off the tissue from the site donor, we wash with a little bit of saline, and by decantation we use the same fat, avoiding the passage between a circuit and another circuit that we know a lot of cell in the centrifugal, in the mechanical movement, died, crashed, or lose some property, and we lost a lot of exosome and growth factor. So the tissue graft obtained from the other methodic are poor with the Cephi confront. So I want to show you the regenerative therapy and lipotransfer and PRP. Different kind of tissue. PRP is only growth factor. ADCC we saw cell, exosome, and growth factor. And lipofilling. Lipofilling is only volumetric improvement of the fat. So it is a cluster selection, it isn't a lipofilling, because the goal is the generative tissue injection is in the superficial plane, showing vascular growth fraction and a DCC, and the result is dose dependent, so it is a medical procedure. The difference with the lipofilling is filling the injection, we take off the fat deeper, and we know that the deep fat is poor of cell, so the C-filler technique is rich in cellularity despite of lipofilling. So it's a cluster selection again, adipocytes, stromal vascular fraction, ADCC, growth factor, fertilizing and showing tissue, a tissue rich in beans, in small beans that grow up. PRP is a merely growth factors solution. So it's only the fertilizing. We use guided cannula to take off the tissue, and we stay in the 15 millimeter up under the skin, so in the set. when we work with the lipofilling, we take off the tissue from the deep adiposal tissue. So the tissue harvested in a superficial layer is rich in stromal vascular fraction, ADCC, and growth factor, and the exosome. The literature demonstrates in some paper that there are a great difference between SAT and DAT in cellularity. It is a procedure effective and standardized because we demonstrated that 15 millimeter deep the skin, we can find a lot of cellular population. This is some speech from literature. And this is our study that confront the difference between our methodic and the other methodic in the market. And we evaluated the cell vitality, the Cepheid device, compared with the other device in the market. And in T0, the cells are 250, but in 72 hours after, we see an increase of this population, despite of the other methodic that remain stable. One of the most promising therapy in the medical field is dose-dependent, standardized, scientific evidence, delicate harvesting procedure, harvesting superficial adipose set with the guide of the cannula, minimally manipulation of the tissue, and decantation of the saline solution washed by lidocaine. So, different kind of fluidity of our tissue can be injected in different layers. So, if you want to stay dermal or very superficial, we have to fluidificate more our tissue. If you want to stay underorbicular, above the temporal fascia, we need the amicrocannula, and we stay with 600 micron 20 gauge needle or cannula. This is a scheme to compare the different kind of fluidity with the needle or the cannula that we can use. So 800 micron correspond to 18 inner diameter of the needle. 200 micron correspond 27 gauge inner diameter. So our tissue have a lot of property, volumizing, regenerative effects, and anti-aging. You can see in T0, T30, T60 time, we will have the best and the top of the regeneration to maintain stable during the time over. As you can see in this video, the improvement of the skin quality after 1 year is very natural, very polite, and we don't have over-treatment of the patient. In this picture, we compared with the Vectra analysis the retidoses of the skin before the treatment, 45 days after, and after 1 year. And as you can see in the picture, the retidose at 1 year is stable. The result is stable. In this video, we can keep the skin quality improvement and the reduction of the spot. This image is better representative to improvement of the skin quality and the scar and mark stretch improvement after 3 months. We published a few months ago multi-center trial. We analyzed 2,036 patients, are retrospective case reports, and we studied the patient in a period of 2 years, and most of the patient was treated only with Cephi, but 45% was combined with other treatment. And most of the time we used carboxy therapy, microneedling, endolift, botulin, hyaluronic acid. So it is a methodic that can be used single or associated with another methodic. And the result was that was very satisfaction, because the complication from the donor side was few, and only ecchymosis and hematoma. The same was for the area injected. Ecchymosis and hematoma and prolonged edema was the main complication that we observed, that resolved in a few weeks months. And if we compare our study with a systematic review complication of more than 5,000 cases, we had a very, very low complication. But we have to avoid some dangerous area if we can. So we have to avoid the glabella and the nose area. If we need to go in that area, we suggest to use adrenaline. We can also use a linear technique to inject in the dangerous area. And most important, don't force the injection when the syringe is clogged. And mandatory is the sign of the consent that you can find inside the box of the disposable. Now there is a video to summarize the procedure of the pickup, so the harvesting procedure, and the injection procedure. We saw that the donor area are different, but in my experience, the best area is the peritrochanteric, because the abdominal area sometimes is very representative, but the fat is poor of cellularity, because it's inflammation. There are inflammation, there are some fibrotic septs, so that septs block the pore of the cannula. So in my experience, the easy and the major quality of fat combined is the peritrochanteric. So I suggest to draw the area before to do the tumescence, because then the patient is lie down in a side, so you lose the projection of the prominence of the area that we want to pick up. There is inside the box sterile drape. Then with a small drop of local anesthetic, we do with the needle an invitation for the cannula. Then we introduce the cannula with the guide. There is 15 millimeter deeper, as you can see, and you stay parallel to the bone plane of the leg, and it's difficult to go up or down because you have the guide that keep your position. This first step, we inject some tumescence with lidocaine, 20%, and adrenaline, 20 or 30 milliliter. It depends from the quantity of tissue that we want to pick up. Then we remove the cannula. You have to wait some minutes, and waiting some minutes, I use the cannula to block some septs and to spread the local anesthetic to make easy the harvesting procedure. Then we will use the syringe and we take off the fat. Try to go a little bit. Oh, sorry. Anybody can help me with the video? The guy with the slide center?
Est-ce que quelqu'un peut aider Dr Badelssin à régler le problème technique?
Okay, maybe. Okay. Then we start with the the pick up step. As you can see in the video, the vacuum syringe allows to aspirate the fluid fat graft. Then we move the fat from the harvesting syringe and we move inside another syringe with a simple connector. Then we take a little bit of saline to wash the lidocaine and the adrenaline from the tissue, and we put the syringe in for decantation. We repeat the procedure 3 or 4 times since we keep more or less 15-20 cc of fluid fat. I try to go a little bit. Okay. This is our syringe with the tissue harvested from the donor area. As you can see in the video, we'll have 3 kinds of tissue. The washing liquid that will be removed. Then, if you observe, we have a white cercin that is the buffy coat, the part, the buffy coat is the cellular part of our tissue graft. Then the microfragmented graft with the other kind of cell. This is our tissue that will be injected in the face or in the other region that we want to treat. Okay, this is the second part of our treatment. With a needle, we do a point of entry point with our cannula. This is a blue cannula, so a 23 gauge cannula. And in this entry point, I work with a fan technique, and I try to improve the volume and the skin quality of the marionette line, the chin and area, and also the perioral, because with the cannula I reach the corner of the lip. I suggest to keep the cannula in the tissue and use a new syringe with
15
some other
minutes. 15 minutes.
Okay. This is another entry point that treat the nasogenial fall and also the cheek, but sorry, but I want to show the periocular area. It is at the end of the video. Okay, with the entry point periocular, we can treat also the scar of an old blepharoplastic of the patient. We can also improve the corner of the eyebrow and also the temporal area that usually is difficult to treat with the filler on other products in the field. This is the patient before and after 1 month, and the results are not only volumetric but also in the skin quality and a global rejuvenation of the patient. This is another clinical case. So, autologous regenerative therapy, reshape and firm, restore the volumes, redensify dermal layers, and regenerate the skin. We combine this methodic with the carboxyl therapy when we working with alopecia, androgenic alopecia, because the carboxyl therapy increase elasticity of the tissue and reduce the irregularity, the scar, the ulcer, and also improve the oxygenation of the tissue. A lot of paper in the last 10 years and also the request of the market push us to improve our expertise in the alopecia, androgenic alopecia treatment. We do paper also with this technique, a combination Sapphire and carboxyl therapy. So, the guided procedure is safe, simple, and effective, standardized, no surgical, no liposuction. The selection, emulsification, and centrifuge allow to transfer the stromal vascular fraction cell from the tissue to the liquid portion. We can work in both ways. We can use the centrifuga and we take only the liquid portion, or we emulsificate with a lot of step by the syringe and inject directly with the needle. As you can see in this slide, we can centrifuge 10 minutes, 3050 RPM, or directly move the tissue, digest the tissue in the syringe. This is the result before and after, with the combination of 3 sections of carboxyl therapy before the treatment of the patient, then a section of art, and then 2 sections of carboxyl therapy. We can also combine the this methodic with some other kind of product with hyaluronic acid, carboxy therapy we said, laser and ABD device. This is a combined protocol with the association of hyaluronic acid. Dr. Janai published also a paper with this methodic. This is a case before and after combination of ART and hyaluronic acid. As you can see in the picture, the girls improve the zygomatic area volume and also the temporal area volume, and a global rejuvenation of the skin. We are working also with the combination with hydroxyapatite of calcium, and this is with courtesy of Dr. Metha, the result after treatment combined filler with CHH. Other combined technique with ABD, with laser or fractional laser, endolift or fractional, and we can improve also the laxity, because we said that the ART is dose dependent for the skin quality, for a little bit improve the volume, but the laxity has to be treated with some other technique, or 3 heads, laser lifting laser, or surgery. This is a tailor-made treatment. We combine endolift and regenerative medicine. Skip this part. This is the patient treated with 18 cc of nanofat, autologous regenerative therapy. And before the ART, we treat the jawline with endolift. And this is the result. This is another case combined endolift and regenerative medicine. This is the treatment of a scar with the combination of laser and injection of regenerative medicine. We can treat also, this is a very great result in my opinion, with the patient who is very happy to improve the scar after the pregnancy. We can also treat the hands. So the field of application of this technique is very wide. And finally, but not finally, also in gynecology's field, skip. This is a lichen sclerosus treatment, and as you can see at the end of the treatment, the improvement of the elasticity, but also the volume and the skin quality of the external part of vagina and the introitus. I want to show the pattern of injection of this technique. The first one at the introitus, so okay. With the needle.
Sorry, Dr. Badelssin, you still have 7 minutes.
Okay. I want to show you some other field of application in complication after surgery. We use 2 sections of filler methodic, and with the dermopigmentation we obtain that result. This is a post-radiation skin damage treated with the 1 section of ART. And this is another case, another complication with the necrosis of the CAC after surgery, and treated with a section, more than 1 section of carboxy therapy, and then 2 sections of regenerative medicine, and the result at the end is good for the healing process and also for the aesthetic result. I finish, and if you have any question.
Thank you, Dr. Badelssin. We still have some minutes if there is someone who has any question to Dr. Badelssin.
Congratulations for this very amazing presentation. And I want to know, because actually in ad therapy for IVF, you use a lot, we speak a lot about PRP and autocell cells. And I want to know if with this, if you can re-inject this preparation directly in the ovary or in the endometrium and helping.
I can hear.
You can't hear. And now you hear me?
Better.
Better? I just asking myself, with this package that you speak about, you can use these cells, these heart cells, and re-inject it directly in the ovary or in the endometrium, and hoping, of course, a good response.
Yes, yes.
What's about that?
Yes, it's simple, safe, and in my opinion, you can do in your office. You don't need an operatory room, you don't need the surgery, because the kit is all in one. You have the stir drape, you have the syringe, you have the cannula, you have all the stuff you need. You don't have the glove, the sterile glove, because the size. All the rest you have inside, so you make your sterile field. You prepare the area to, you choose the area. It depends, you are a gynecologist. So in your field, frequently I pick up the cell from the abdomen to avoid to move the patient from a side to another side. Even though, in my opinion, the best quality of the fat is peritocranteric. But if you have to to inject in the genital area, is simple, more simple to choose abdomen as a harvesting area. But it's very simple. The procedure at the beginning, when you are a beginner, is 1 hour, but then after 3-4 sections, you move slow, more easy, and 45 minutes from door to door. Okay, I suggest sometimes to give to the patient some drops to put a little bit more relaxed, but not more than 10 drops of. But the result motivates the patient to improve with another section after 1 year, 6 months. If we suggest another section because we think that the patient will need, patient ask us another section because the symptom improve. Now share aesthetic field from the functional field. And the functional field, patient asks to you, make me another section because I feel better. With patient with
Micro.
No, because I'm not a gynecologist. But I know but I know there are a lot of study and a lot of promise for the future of the patient. Infertility field.
Est-ce qu'il y a une autre question? Oui, oui, vous parlez français.
Je suis désolée, mais je n'ai pas bien compris la différence entre votre technique et le lipofilling qu'on fait.
The doctor is asking about what is the difference about cephaline technique and lipofiling.
Lipophiling. We, at the beginning, I show you in a slide the difference between SAT, superficial adipose fat, rich in cellular line, and that deep adiposal tissue. And there is a difference. We demonstrate, not only my working group, but the literature, demonstrate that 15 millimeter under the skin, we can find a lot of kind of population. If we keep the tissue from that part, we can talk about art. If we pick up the tissue under, with the fat is more, the depositor are bigger, and you need a bigger cannula, and so you talk about lipofilling.
Thank you so much, Dr. Badelssin, for your
Just 2
great
minutes.
presentation. It was very clear, and hope to see you tomorrow in another presentation.
Yes.
Okay? Thank you very much.
Right, Council.